Could you sort of, somebody go through what the lobbyists are spending to try to keep this from us?
That's right. That's right.
That people pay for what they want.
People have a right in America to organize and lobby, and the lobbying expenditures, frankly, have a lot more effect when people aren't following the legislation. I don't think we're going to have that problem with this bill. I think people are also letting their views be heard, and I think on this one, I'm hoping that the people get heard, and they're being heard on both sides, and people tonight are being a lot more respectful about other people's opinions as we've seen on cable television. So
that's something that Dr. Joseph said I wanted to address. You were talking about the disparity between the insurance costs between women and men. I just wanted to point out that they also do that in life insurance and in auto insurance, and hopefully the government won't decide to take that over next. Reference back to President Obama's statement about the blue pill, red pill situation, and as a pharmacist I know that that is not always the answer to the question. If prescribing a narcotic to alleviate pain is less expensive than performing a surgical procedure to correct a problem, how many drug addicts do you think the government-run healthcare plan will create, all in the name of cost efficiency?
Good evening, Congressman Scott. About 3 weeks ago, I contacted your office before you announced you're having your panel meetings and asked for a face-to-face meeting. And I'm glad I get to see you. I was told I could go to the webpage and apply for a meeting, which I thought was rather odd. I had to apply for a meeting with my representation. Got no response. 2 weeks ago tomorrow, made a follow-up phone call and explained the situation, and was told someone would contact me. We're still waiting on that call. But it's good to see you here. It's really good to see you actually reading a bill, unlike the cap and trade fiasco. But you believe healthcare is a right. You said that earlier. And you have your pocket constitution with you. Pull that up. Does that contain the Bill of Rights?
yes.
Could you refer through that and tell me which right that is?
Well, it's not a constitutional right, but I believe it is something that we ought to have for if it wants to be available to everybody. It's not a right. It's not a right based on the Constitution, because if that's right, we already have it. We're trying to provide health care for everybody. Some people agree with it, some people don't.
Okay, well, on that note, like the one lady before who was trying to save money by dropping her health care, if I decide to do that, under this bill, the IRS is going to automatically enroll me, penalize me for not having health care. They're going to penalize me for not exercising my right, as you call it. So what other rights am I going to be penalized for not exercising?
Under the bill, everyone will be required to buy insurance or be assessed a fee of 2.5% of their income.
And the government will have access to
their if we're going to cover everybody, then everybody has to get insurance. If we're not going to have universal coverage, we're not going to have universal coverage.
I've read cap and trade and the healthcare bill as it is currently proposed. And one of the things that came to mind as I was reading it is, who in the earth is writing this stuff? I know in the case of cap and trade, that the people that voted on it couldn't possibly have had a chance to actually read it, because the last 300 pages of the bill never even made it to the floor of the House before it was voted on. After a little bit of research, I've figured out who's been writing these bills, and it's something called the Apollo Alliance. And what this seems to be is a bunch of environmentalists and union leaders.
What's wrong with that?
Bills. Now my real question is, they're writing healthcare, they helped write CART, they wrote cap and trade almost completely. What makes it so that you trust these people enough to let them write our laws without reading them?
The bills are drafted in legislative services, which are congressional employees.
But you didn't read it before you voted for it, at least in that case. Captain, the healthcare bill, I know you're reading it because we're grilling you on it right now and you're answering questions quite well.
And that's what we're talking
Well,
about.
do you have something in the bill you like or don't like?
I don't think the government has any business trying to run more of our economy because they suck. It would also be, what makes you think that the government would be able to run this particular program well, or any better than it's run the other things in the past?
Expected to run as well as they run Medicare today.
First, I'd like to say that although it needs some fixing, it's the greatest country in the world. We have the greatest healthcare system in the world. But I wanted to say that socialism doesn't work, and that's proven by the imminent demise of Social Security and Medicare. They're going to fall. What works in this country is the people.
Yeah.
You won't find God in country for socialism is my question is, instead of trying to force it on the people that don't want it, why don't you just fix it for the people that can show a need and do want it?
You can't allow people to wait till they get sick before they buy insurance.
That's right.
And trying to figure out how to deal with that. States that have tried to do that, eliminate the pre-existing condition exclusion, without having everybody have to buy insurance, ended up having to eliminate that program because people started waiting till they got sick. The only people with insurance were sick, and the average cost went through the roof.